intensified malaria control. Actually, the topic is National Vector-Borne Disease Control Program, Nbb Dcp. We will talk it in our revision slides, but here I will talk about the intensified malaria control, this Nbb Dcp categories. So this comes under one of the category of Nbb Dcp. So the question asked was, intensified malaria control under the National Framework for Malaria Elimination is defined. So they are asking the definition of this one, intensified malaria control. So the options given were first option, states with API more than or equals to 1. API is your annual parasite index. Option 2, zero incidence of malaria. Option 3, no longer a health problem. Option 4, 3 consecutive years with zero transmission. Okay, so now we have to see the categories first, and then we can come to the answer. So I am discussing the topic Nbb Dcp, National Vector-Borne Disease Control Program categories. So there are 6 diseases under this program, out of which 5 is caused by mosquito and 1 by sandfly. Right, we will discuss that in our upcoming slides. So here I am discussing the categories of Nbb Dcp. So category, definition and naming, all 3 is important, right? First I am moving to category 0. So category 0, there is definition is zero indigenous case of malaria. So category 0, zero cases of malaria, and the naming is as prevention of re-established phase. Right, prevention of re-established phase. Now category 1, there are 4 categories, category 0, 1, 2, 3. So category 1 is defined as state where API is less than 1 and all districts API is annual parasite index, right? I mentioned already, API less than 1, so both is less than 1, right? And the naming of the phase is elimination phase. Nice. Moving forward is category 2. Again, state API where API is less than 1 and district where API is more than 1. Now here something has changed, district with API more than 1, correct? Okay, and the naming is pre-elimination phase. Right, moving on is our last category, which is your category 3, where all states with API more than equals to 1 and your naming is intensified control phase. Now you got your answer. So intensified control phase, states with API more than equals to 1. So this is what has been asked in your question. The intensified malaria control phase is where states with API more than equals to 1. So option A is your answer. We will revise the categories again. So what I told was that category 0, where there is zero incidence of malaria, naming is prevention of re-established phase. Next, category 1, where states have API less than 1, district same API less than 1, elimination phase is the naming. Category 2, where state API less than 1 but this time district API more than 1, known as pre-elimination phase. And the last category, category 3, states with API more than equals to 1, and naming is intensified control phase. So I hope this topic is clear, right?